In the 15th century,
郑和
led his fleet on 7 voyages to the western seas, with his fleet carrying numerous medical officers, physicians, pharmacists, midwives, and more. Under the Belt and Road Initiative, traditional Chinese medicine, TCM, is once again setting sail to open trade routes across mountains and seas with a single silver needle. This year, practitioners from Yun, a city in western Sichuan Basin known as the hometown of pandas, will also set out on this voyage of cultural exchange. On the first day, a patient named Dou visited the miraculous department. For years, Dou had suffered from persistent pain in her palms. Therefore, TCM practitioner Shen Xingfu from Yun decided to treat her using TCM's acupotomy techniques. After administering a trace of anesthetic into the gap between Dou's thumb and index finger, Shen precisely inserted a small needle knife into the affected spot in order to release adhesions and relieve abnormal tissue tension. Dou began bending her thumb slowly, groaning in pain. But after the acupuncture treatment, the effect was immediate, with Dou moving her hand to give Shen a thumbs up with a smile. The next day when Dou came for a further consultation, her fingers, which had been painful for years, were able to move freely and without discomfort. Acupotomy has been well received locally. In Siem Reap, Cambodia, 80% of the population engages in agricultural production, primarily rice cultivation and fishing. The heavy agricultural work combined with the humid and hot climate has caused severe damage to the joint tissues and muscles of numerous locals, resulting in widespread pain issues. Tennis elbow is a particularly common condition among the locals. The small needle knife used in these techniques resembles an acupuncture needle in appearance, yet features a narrow blade at the tip, thus enabling dual functions of both needling and incision. Additionally, the knife represents a novel traditional Chinese medical device developed by integrating modern Western surgical therapy with traditional Chinese acupuncture therapy. This therapy creates larger wounds than those by acupuncture, along with more intense pain. However, patients do not require hospitalization. The treatment takes only 10 minutes, and the pain typically disappears after 2 to 3 days of rest. During the treatment period, the traditional Chinese medicine culture festival commenced. Throughout the event, the Yun medical aid team sent to Cambodia presented local patients with TCM products such as medicinal pillows, herbal sachets, herbal foot bath packs, and medicated plasters, while also conducting free medical consultations on site. Throughout the treatment, there was always a figure who carefully observed the doctors, took notes, recorded videos, and asked questions. He is Lot Rod He, director of the traditional Chinese medicine department at the Siem Reap Provincial Hospital. Lot had studied Western medicine for 7 years and completed 2 years of systematic training in TCM. Sometimes, even chicken feet can also serve as a significant learning tool for Lot. Lot noted that though TCM requires only minimal examinations, its diagnostic methods observation, auscultation and olfaction, interrogation, and palpation alone enable precise treatment, showcasing its profound depth and breadth. Additionally, Lot has studied acupuncture, scraping therapy, cupping therapy, and other TCM techniques, aiming to treat more local patients. During the learning process, Lot also developed a passion for Chinese culture, frequently reading a Khmer language translation of the novel Romance of the Three Kingdoms. The miraculous TCM practitioners of the Miraculous Department have won over scores of Cambodian patients, while also conveying Chinese medical skills and compassion to more medical professionals worldwide. Notably, the Miraculous Department has earned widespread acclaim among the locals through word of mouth. Doctors from Yun also engaged in exchanges with local Cambodian physicians, delivered lectures, and established educational training bases. Preliminary statistics indicate that over the past 10 days, the Yun medical aid team sent to Cambodia managed to serve over 1,000 Cambodian patients. The story of miraculous TCM practitioners going global continues to unfold.